Now, what is the pathogenesis of hepatitis A and E? It's an acute self-limiting hepatitis. This is some of the common features. Liver injury is immune-mediated rather than directly cytopathic, like what we said. And immune-mediated means what? You have the natural killer cells, the innate immunity as well as the adaptive immunity. The innate immunity is mainly by who? It's mainly by the NK cells and interferon and interleukins. They are the ones which are the main mediators of innate immunity. The adaptive immunity is mainly by the CD8 helper cells, CD8 cytotoxic cells, CD4 T helper cells. Okay, so it's an immune mediated rather than directly cytopathic. Cytolytic CD8 T cells play a major role along with the CD4. So CD4 basically it promotes or it increases the response of the CD8 cells. So all of these viruses, it's not a cytopathic, it's only immune mediated, innate as well as adaptive immunity. Innate is predominantly by the NK cells and interferons and interleukins secreted, whereas adaptive is by the T helper cells and the cytotoxic cells. So HEV and EV shedding occurs before the clinical symptoms. So this is what we said. Before the clinical symptoms means what? When during the incubation period. Explaining why there is a high transmission rate before diagnosis itself. HEV interferes with the host antiviral defenses, including interferon signaling, which may prolong infection in immunocompromised individuals. So this is the only condition in immunocompromised or in organ transplants. These are the conditions where you can have a chronic hepatitis E infection. So this is how the chart goes. HEV is initially present in the stool as in the serum as well, hepatitis A. And there's increased fecal shedding initially itself. So what is the incubation period? It's about 15 days to 45 days. So 15 days means within 2 months. So before the first month itself, you have already an incubation period. The patient is drastically spreading infection. Then only the symptoms develop. So once the symptoms develop, you have the prodromal followed by the jaundice phase. The peak and LFT occurs even later. So before that itself, he has already shed enough prodromal and jaundice. And by the time the jaundice phase decreases, the fecal shedding also disappears. The fecal shedding persists only as long as the jaundice phase is present. Okay. Finally, they develop antibodies. So a few days after the HEV is present itself, our body produces what? IgM anti-HEV to eliminate the virus. Those who have suffered a long infection, remote infection, usually they'll be positive for total anti-HEV antibodies. So how is the diagnosis? Diagnosis is mainly by the serology. Okay, and HEV virus can also be seen in the stool as well as in the serum samples. In fact, even if you do a liver biopsy, also to be evident there. So IgM anti-HEV indicates an acute infection, which is the easiest way. IgG indicates a past infection. Lifelong immunity after infection happens, but sometimes you can have some of the atypical presentations of hepatitis. One is you have the prolonged phase. There's a prolonged where more than 4 weeks also, sometimes the pain go up to 3 to 4 months, the patient may have jaundice. Prolonged phase, or you have the relapsing phase of hepatitis. That means a recurring. Just few months after the patient has already suffered hepatitis A, they might be having a relapsing of hepatitis A, which is again diagnosed by the presence of IgM anti-HEV, okay, which means it is not yet recovered fully. Still, it is relapsing. And another one is a profound cholestasis, what we already said. So these are some of the atypical manifestations of hepatitis A. Okay. Vaccination provides a long-term immunity. You have vaccinations available, monovalent vaccines as well as divalent. Divalent is with hepatitis B vaccine also, twin risks. Okay, so we'll be coming to that.